Hey guys, welcome back. Thank you guys so much for joining us. Hi everybody out there. I'm so excited for today's Ask a Dietitian workshop where have a lot of questions, and I know there's been a lot of craze about the weight loss medication. So some of you guys reached out to us and asked a few more questions on that. A quick reminder, guys, everything that we covered today will be posted in our YouTube channel. So there is the link for that in our bio. So if you're driving or just kind of listening to us and you're like, oh man, I wish I could take notes on this, you totally can go back to the recording. We place them in our playlist called Ask a Dietitian presentation. So you can go ahead, look for the topics that we talked about today. And we can go ahead and provide you guys that for you guys, because we want you guys to have resources and everything to kind of continue your journey. I'm so happy to see a lot of you guys out there. Thank you guys so much for joining. So let's get started right away, because I feel like we're going to take a lot of time speaking about this in terms of there was a lot of women's health, a lot of weight loss questions being asked. So I want to make sure I'm going to compile them all into like one large answer. Remember that you're more than welcome to ask questions during the chat. You can put them in the chat as they're coming up. So I'll try to answer those as well. Okay, so let's get started with, we had a few of our followers ask about a lot more fertility-like questions. So one of our followers asked us, hey, what would be good for ovarian health? What foods should we consume or stay away from? We want to keep our ovaries nice and healthy. We've had other questions in that same kind of branch of women's health, and specifically PCOS patients that have reached out to us and said, hey, if I have PCOS, how can I increase my fertility, right? So we're gonna look at that question from the nutritional standpoints. Other people have asked us, hey, I'm trying to get pregnant, right? I think we're getting a lot of these pregnancy questions because I'm pregnant, so, and I know we're putting a lot of content out there for that. So in women's health. Also, guys, in July of this year, Vera's Wellness will open up its very own women's health and fertility wing to our business. So we're going to provide services and a lot of resources specifically for maternal health, right? Specifically catered to the women, because we as the moms, we are the teacup that pours onto all the other tea, the teapot that pours onto the teacups. But remember, ladies, that we cannot pour from an empty cup. So like I said, we're going to have everything from lactation consultants, OBGYNs, pelvic floor therapists. I know as I've treated some of you guys out there, we've realized that there's very few knowledge in terms of that field into how do I prepare my body for pregnancy, for a healthy pregnancy? How do I have a natural healthy pregnancy? And postpartum, after that pregnancy, how can I stay healthy? How can I prevent postpartum depression? If I do have it, how do I deal with it? How do I even recognize it? So we brought on we contacted a whole list of like I said, pelvic floor therapists, mental health therapists who to kind of provide you guys packages and options for that. So stay tuned. We will definitely make a video about all that in regards to our grand opening. Okay, so let's get into the whole reproductive health. So it's women's health and ovarian health, right? When it comes to understanding how food affects the female reproductive system, we've got to understand that the system is driven by hormones, and hormones, the production of them, the release of them, everything that a hormone does in our body can often has a nutritional component. Let me give you an example. As women and men too, but if you're not consuming sufficient fats, your body does not have the right amount of cholesterol, which is the backbone of if you look at the chemistry structure of each hormone, these are fat, the hormones are kind of made up from fats, made from cholesterol, right? So if you're not consuming enough healthy fats, right, you're not going to have the foundation to build enough and make enough hormones. So we definitely have had patients who their estrogen or progesterone or just overall reproductive hormones are low, right? And we find out that they're not consuming enough dietary fat. So making sure that you can consume enough is going to be key. Now, enough will, vary from person to person, because some people can consume very low amounts of fat and still produce enough, that. But in terms of in general guidelines, the American Dietetics Association says that a low fat way of eating, so the lowest you can go, is about 25 to 30% of your total daily calories coming from fat. right? So I know there's sometimes a lot of our patients who prefer carbohydrates or say, hey, Carla, we want to have more carbs in our meal plan or in our, way of eating. And I say, awesome. Okay. In that case, the lowest that we can go, I usually, start up at 30 because 30 is actually pretty low. Okay. And then from then on, we just see how they feel and how they're, they're doing everything. Now, if you're working with your OBGYN, which you should, if you're, undergoing a fertility treatment and you guys are, pairing up with them, this is where they can now, take your blood and see, how the food is affecting your different hormone profiles. Okay. Now, second to that, but kind of aligned with that, is what we call the energy availability. A woman's body needs to have enough energy available within herself in order for everything to work properly. Okay. And by energy, yes, I'm talking about calories, right? If a woman is not consuming enough calories, is not consuming enough energy, her body will say, hey, I barely have enough energy to keep you alive, let alone another human being, right? So it will actually call what we call menstrual dysfunction. It'll disturb your menstrual cycle in some way, shape, or form, so that it prevents reproduction, because it doesn't seem the environment as safe enough for reproduction, right? So medically speaking, we always tell our women, never consume less than 1,200 calories, okay? At usually 1,200 calories, we jeopardize organ function. Now, some women, right, depending on how active they are, depending on the amount of lean mass that they have, depending on a lot of different factors, they can see menstrual dysfunctions even at higher levels of calorie intake. That's because they may have more muscle mass, right? So somebody that has more muscle mass will need a lot more energy to move around, right? Because muscle is life tissue. It needs calories in order to survive, okay? So we see that. So we actually, depending on how active that woman is, we never recommend that they go underneath what we call their basic metabolic rate or resting metabolic rate, right? Two different things, but the resting one, remember, the resting one is what your body just needs in order for you to be alive just by existing, not even additional movement and stuff like that, right? To some women, depending on their height, depending on their lean mass, right, that will differ from woman to woman. So remember, guys, if you're like, well, I don't even know where to start, Carla, like, where do I go for that? Remember that we here at Veris Wellness, we believe in guiding every single one of you towards the right direction. So in our bio, there's also a link to have a free 45-minute consultation. I feel it's my professional duty to guide everybody in the right direction. So those 45 minutes are yours with me, and you can ask me whatever you want, right? You can ask me, hey, am I taking the right macronutrient intake for my goal, right? For my condition. Use that to your advantage, guys. Now, so going back to the whole energy availability thing, in this energy availability, right? So the energy that's roaming inside of us, by the way, doesn't just come from what we eat, right? It comes from also if we have, excess body fat or body fat that we want to get rid of, your body will get some calories through there. But remember that your body can only transform, body fat into, usable energy so fast, right? This is what we see in research. We have seen menstrual dysfunction happen with women who are even overweight and obese, right? Because even though you have enough stored energy, you don't have that energy is not available just yet in your bloodstream for your organs and your reproductive systems and everything to you. That's why it can get very tricky in what is necessary and needed for your body to be at optimal health, okay? So making sure that you are eating enough calories, I would say, is the number one step, okay? All right, so moving forward as to, hey, what foods are gonna be good for me towards getting this good ovaries, healthy healthy reproductive system in order for me to get pregnant, okay? Now, I'm going to answer this in a two-sided question because there is somebody that has asked us about and they have PCOS. So I'm going to answer this for the general population that does not have any clinical condition and for those that have PCOS. Okay. Now, well, for both areas, research shows us that the more whole foods that you eat, the better your system will respond. Remember, the human body was, made to function off of proper fuel, whole foods, right? So the more whole foods that you consume, the better you're off, because the better your system will respond to that, okay? And specifically for the PCOS women, we know that the processed foods actually seem to affect them even more. So to that PCOS person, I would say you want to eat whole foods even more than anybody else out there because your body will be very responsive to that, okay? We see we've had patients who are eating the right amount of calories, but they may be getting their calories from, more chips and cookies and something like that, and less from fruits and whole grains and stuff like that, right? And the minute they eat the same amount of calories, but they make that shift into more whole foods, they see a dramatic result. And some of them have even gotten pregnant just by making that shift. So know that the quality of the food does matter, and specifically when it comes to women's health. I'm gonna take a sip of my water because I see a few more people coming in. Thank you guys for joining. And I get really, really thirsty too. Okay, so now let's continue in foods for ovarian health. Okay, stress is another thing that the female body is very finicky and sensitive to, okay? So we want to make sure that we really know how to manage our stress, right? And stress, remember, can come in 3 different forms: physical stress, mental stress, and emotional stress. And you need skills to know, identify, and manage all 3 of them, okay? If you guys have questions with that, please reach out to us and we can guide you guys in the right direction as to what is needed. Now, regardless of the type of stress, your body will actually respond the same way to too much of either one of these stressors, okay? This is what we call the fight or flight response, right? In response to stimuli, right, to different things that can happen around us. Let's say I have a boyfriend and he breaks up with me and I'm like stressed out, right? Or I lose my job, I'm fired from my job, right? Or one of my loved ones is in a car accident, right? These are all mental, emotional. Or let's say I, fall and break my pinky, right? That's a physical stressors. My body will actually respond the exact same way, the flight or fight response, to all of those type of stressors, okay? I know, it's weird, right? It's weird how, pretty cool how our bodies are made. Now, with this stress response, there are 2 major, things that are released, 2 major hormones. One is cortisol, okay? We know that has to be the stress hormone. And the other one are called the catecholamines, or the stress hormones. These are going to be your adrenaline, noradrenaline, right? Things that make it so that your body can deal with that stress right there, okay? Now, one of the things that happens with chronic stress, so if you're stressed out all the time, and specifically high cortisol levels will affect the luteinizing hormone. Luteinizing hormone is rarely correlated with the ovulation part of your cycle. So if you're too stressed, your body will suppress your luteinizing hormone, which can cause a little bit of this anovulation, not ovulating properly, ovulating late, being random. So a lot of things can differ from that. So let's look at which foods can increase stress or which foods can actually make stress cortisol go down. We're gonna dive into a branch of food now called medical nutrition therapy, MNT, okay? Now, carbohydrates, and specifically starchy carbohydrates, whole grains, right? Complex starchy carbohydrates have been shown in research to lower cortisol levels. So which ones are these? These are going to be like your potatoes with the skin on, right? Remember that the minute you take the skin out of a potato, it becomes a simple carbohydrate. So we want that complex carbohydrate, right? Lentils, legumes, beans, right? These are all legumes. They fall into the same category. Whole grains, so corn, oatmeal, farro, whole grain rice. If you like white rice that's whole grain, that's going to be your basmati rice, right? Let's see what else. Vegetables, are going to be peas, right? These are whole grains that will actually make your cortisol levels come down. If you look at a lot of people's comfort foods, they actually have high amounts of these starchy carbohydrate foods because carbohydrates in and by themselves will lower your cortisol levels, right? This is a lot of the times for people, they're like, oh, Carla, I'm a stress eater, right? I tend to gravitate towards chips, notice the type of foods that your body's kind of gravitating towards, right? It's because your body knows that by consuming those chips, right, it'll bring its cortisol levels down. So your body's actually doing something that it naturally does. There's a biological root cause to why you're doing what you're doing. Now, you can reach for the chips, or you can make yourself a really comforting, chili, like turkey chili, right? Like with, really good cornbread, right? Like that's going to be a great mixture for you rather than a bunch of chips, right? More whole foods rather than not, right? And that's, by the way, another thing that we do here with our patients. We go through the different recipes that they like, their comfort foods, and we show them how to have them in a more wholesome manner, right? Especially if they're PCOS and something like that, right? Now, so those are some of the foods that they're like high up on the list, right? So for us dietitians that deal with cortisol levels, patients, we tend to recommend a lot of these starchy, whole grain complex carbohydrates, okay? Now, which foods will increase cortisol, okay? So I'm gonna get a little sciencey on you guys. So if I lose you, let me know, okay? So, inside of our bodies, there are a type of chemical compound that can actually damage our cells. These are called reactive species, like ROS, reactive oxygen species, right? These are going to be like your, N-oxide, right? So I'm not going to get through all the chemistry, right? But what these things do is they can literally target your cells and they can pierce them. And these are the things that we want to be, kind of aware of, because these are the things that if it damages your cells, it could damage the DNA in your cells. It can cause mutations. And, these reactive species are the ones that we know can lead to different types of cancers, right? It can lead to all sorts of other bad things, right? But, what we want to do is make sure that some of the foods that we're eating are not transforming themselves into these type of chemical compounds that are damaging to our cells. In specific, and I bring this up because summer is here, guys. Okay, you guys know that like char stuff that we do when we grill meats, when we barbecue. Okay, well that char stuff, when you consume them, it becomes into a reactive species, right? So we want to be careful to not consume too much of that. Okay. And we want to make sure that we're not consuming things that can, like I said, damage our cells and stuff like that, right? Another thing to kind of watch out for, I'm going to go back to the positive, what things to eat, right? High vitamin C foods, okay? So vitamin C is what we know as the most potent antioxidant that we can consume via food form, right? There's actually one other, glutathione, which is the most actually potent antioxidant known to mankind. Our cells produce that actually, so your cells got you on that one, okay? But if you eat high vitamin C foods, right, they're going to help kind of what the vitamin C does. It attaches to this reactive species and it takes it so it can get cleared out of our body. So these are like your good soldiers. They're actually looking for those damaging chemical compounds that can damage your cells, right? Now, high vitamin C foods, they're super, super abundant. Orange juice is not, like I said, it's not the most, it's the highest one out there. Oranges actually got its craze, from back in the day when we produced a lot of oranges and we needed to find a way as a society to market that, right? So that's actually a marketing thing, because kiwis and strawberries, like a serving of that might have more vitamin C than an orange, right? So either way, if you consume oranges, the whole orange with the skin, right? Kiwi, strawberries, right? All of our berries are very high in antioxidants. Bell peppers, right? Red bell peppers, and specifically, this is why I love our chili recipe. If you guys are wondering, in our post, we have our high protein chili recipe, and that one has a lot of vitamin C in it, so please look at that. So these are the kind of foods that you're going to want to gravitate towards and have instead of those things that can cause like that char stuff in the barbecue, right? There's proper ways to grill, so if you guys are wanting to know that, please hit us up and let us know. We actually have a handout that we can give you guys for healthy grilling. Okay, so lowering the cortisol, right? Lowering the stress levels, and now there's obviously other practices that can kind of help enhance this lower, stress levels, in your overall life, right? We can do walks, exercise, right? We can do meditations, right? Remember that physical activity, exercise in and of itself is a stressor, right? So a lot of the times I tell my patients, think of your stress levels as a bell curve, right? On one end, if you get super stressed out, it's not good for you. At the other end, if you're lethargic and you're not moving and not doing anything, that's also not good for you, okay? But for example, let me give you an example in which the type of exercise can actually be detrimental if you are trying to get pregnant, but you're super stressed, okay? So HIIT, high intensity interval training, is not recommended for the person that lives a chronically stressed lifestyle, right? My headphones just died, so I'm gonna make sure that I'm gonna get a little closer for you guys. So if you guys are in a high stress level state for whatever reason, we recommend that you do things that are not super high stress, high interval, right? We're not pushing our bodies even more physically, especially if mentally we're already blocked out, right? Okay, so we wanna make sure we're not doing that, okay? You wanna do maybe like a lower resistance training, some weights where you can take your time, take a deep breath, meditate, meditate, as you're doing your exercises, think about the problems, think about how awesome life is, think about the positive things in your life, right? All those things, right? The more stressed out you are, the less intense you want your exercise to be, okay? Alrighty, now let's go back to the foods and how foods affect us. So once again, I'm gonna recap a little bit. Eating enough calories, eating enough healthy fats, right? So for both men and women, it can affect the reproductive hormones. So for men, men that don't consume enough dietary fats, right, have been shown to have less sperm count and more problems with ED, erectile dysfunction. So be careful with that for my gentlemen. With women, obviously, any part of our menstrual cycle can get jacked up. The ovulation part, right? The menses part, when we actually bleed, right? The fluctuation of the hormones, whether it be LH, estrogen, or progesterone, right? So all of that stuff. So make sure we're, taking care of our bodies from the physical end, mental end, and spiritual, right? And foods as well, okay? Now, let me go a little bit more into that PCOS state, right? So if you have PCOS, right, we know through research that a reduction, often PCOS women suffer from the inability to lose body fat or lose weight, right? So research shows us that if you drop your body weight by about 10% of your total body weight, you actually will see improvements in your fertility. And in my professional opinion, this is true for anybody, having a little bit of overweightness or being in that obese category. Dropping your body fat will always, to healthy levels, right, will always be beneficial to your body, because excess body fat causes more inflammation in your body. And that's one of those things that your body senses and then says, hey, there's a lot of inflammation. It's not good for me to make a baby in here, okay? So making sure that, we're looking at what a healthy body fat percentage range is for your age, for your activity level, right? In my opinion, the BMI scale is not a good representation of this, right? I don't know if you guys know much about the BMI scale, but the BMI scale was actually, if you look at how it was, the population that we used for to make the BMI chart, it was on the female Caucasian sedentary population. So unless you're female Caucasian and it was on the East Coast, living in the East Coast, right, and you were sedentary, then this doesn't apply to you, right? The minute my patients go from qualifying to being into the active population, so working out 3 days per week or more, I don't use the BMI chart with them. I use their body fat percentage. So if you guys have questions on that, you're like, Carla, where do I follow? Please reach out, make a free consultation with us, and I can show you for your age category which one is deemed healthy, right? So, and this goes back for my athletes too. I know the old school way of thinking was that if you had lower body fat percentages, you couldn't have a healthy reproductive system. That is false. You can have a lower body fat percentage, right? And for women, we deem like those lower body fat percentage ranges like below 19%, right? You can very well, be at 13. I've seen women 13, 14, 15, 16% body fat, but they look shredded, right? And they have their menstrual cycle. That's because they're eating enough energy to maintain their biological processes, to make sure that their heart can pump healthy, their liver can work, the lungs can expand, right? All of these things. So we want to make sure that for the amount of activity and specifically that you're doing, the amount of lean mass that you are having, you have enough energy available in that part of your body. And a big part of that is consuming it enough through food. Okay, so my PCOS patients, if we reduce that body weight, right, by a little bit more, the body fat, remember, not just the weight. When you step on the scale, that's the sum of four numbers: your bones, your fat mass, your lean mass, which are your muscles, organs, in your bones, right? So you step on that scale is not going to tell you about fat in and of itself. You got to get your body fat percentage tested. A lot of ways you can do that. Let me know if you have any questions on that. Okay, so moving forward into these weight loss injections, because this is a great transition in this. One of our viewers asked us if, she's thinking about taking this medication. She doesn't know if they're going to be good for her. She's wondering if, if she's going to become dependent on it. These are all very reasonable questions to have before taking an actual medication, okay? Now, your provider, if you guys are considering taking these weight loss medications, make sure you ask your doctors full, thorough questions about them, okay? First and foremost, know that each medication that has been released, and right now there's a lot of them, Ozempic is under the loop a lot, Mounjaro is in the loop a lot, Zepbound just got approved, so we're like, okay, so these medications were meant for a specific population, okay? So make sure that if you're gonna take this medication, you fall under that in that population that this medication was meant for, okay? We've had, for my PCOS patient person that I asked this, right? So I've actually used weight loss medications with some PCOS patients, and we've seen incredible results. And specifically, we used Mounjaro because Mounjaro was developed for the diabetic population. And the underlying clinical condition that diabetics have is what we call insulin resistance. So PCOS patients often also have insulin resistance, and that's what makes it a little bit more challenging for them to lose the body fat, okay? So this medication was meant for this person, right? So one of our patients lost a lot of body fat. She was losing body fat with regular conventional methods, but it was going very, very, very slow, right? The minute, we asked her doctor about it. It was literally her, myself and her doctor working together to make sure that she was getting proper care, right? She became pregnant, and now is pregnant with, I believe, twins. So yay, congratulations to you, love, right? So once again, these medications, when you take them, they change what we call your physiology. They change the way your body works, right? Now, if you're unaware of how these medications change, and each one of them change your bodies differently, right? That I can give a whole hour presentation on this. Actually, in our YouTube channel, there's a class that I gave on weight loss medication. So if you guys have a little more questions than that, hop on over to our YouTube channel, and I go through in more detail about these medications. Okay. So once again, knowing that you are the right person that's supposed to be taking these, and then when you're taking these medications, they're going to change your physiology, right? You're going to change the way your body works. Learn how that works, but what that change is, because there is a dietary protocol, right? Meaning there's a specific way in which in research, it showed that if you're taking this medication and you follow this way of eating, it'll give, these results. In this case, it was, drop body fat percentage and drop weight, right? So now, when you stop taking this medication, your body will revert most likely back to the way it was working before. Now, with these weight loss medications that just got approved not too long ago, we actually don't know. They haven't been used out in the market long enough for us to know their long-term effects, right? So I can't say for a fact that they will not change your physiology permanently. I can't speak about the possible side effects long-term, right? Because we don't know that yet. What we can tell you is that there will be a change once you stop taking the medication, right? The human body, and this is a response from my professional, and experience, education, and decision-making process, right? The human body has a remarkable ability to heal, okay? I've witnessed it myself firsthand, right? For those of you guys that don't know and why I'm so adamant about teaching women about their reproductive system, I was actually misdiagnosed with PCOS. That's how I ended up knowing so much about it. I lost my period for about 2 years and then got really freaked out about what happened. At that time, I lost it due to stress. I now know this, right? But back then, we didn't have the research that we have now. And my OBGYN at that time thought that I lost it because I had PCOS, right? But it turns out that I was just super stressed out because I was going through a divorce, right? So this is how I got to know so much about it. So if you're once going back to the physiology, right? If you're changing your physiology by taking this medication and then switching back to it, right? Know that, hey, once my body comes back to changing the way it was before, you now have to understand how excess fat got built up inside of you in the first place. Because knowing that, we'll know, hey, back in the day, I had those habits which didn't serve me, which is what led me to put on the weight, right? So things that will change your physiology for my women specifically is going to be if you take the medication, right? If you have any other underlying clinical conditions such as PCOS. Another time during a woman's life where her physiology will literally change is perimenopause and menopause. So if you guys fall into any of those categories and you guys would like more guidance, please, please, please make that free consultation. Remember, the link is in the bio. Thank you guys so much for joining. I hope this helped. If you guys have any more questions, remember that you guys can, hop on here on the third Friday of every month. You can DM this ahead of time, the questions. We'll try to get to all of them. And once again, thank you guys for joining. Have a wonderful day. Bye-bye.